Um, and thank you very much for your guided sitting meditations. It's were very nourishing. And this is what we practice in Buddhism. Um, we the way we learn Buddhism or the way we learn the teachings of the Buddha is from practicing, experiencing directly, using our body and mind rather than learning the knowledge and accumulate it and keep it there in our brain. So that is why that only half an hour of sitting meditations give us a lot of benefit. The way that we recognize the body and recognize and be grateful of all the organs, the part of our body, and how our body keep us alive and all of the silent work in of the organs, all of the organs in our body that keep us healthy. So actually, half an hour of guided sitting meditation from Sister May is enough for us for this session today, actually. We don't need to learn anything else more than that. Do you agree, Sister May? So, but today I would like to share with you more about we still continue on the topic of listening to the body. So this evening, I will share with you more about the anatomy of the body in a very simple way. So remember, this session is not intended to make you become a doctor. And I would like to know, is there anyone have learned or is there anyone have a background of healthcare professionals or any ones who already know about the anatomy of the body? You can raise your hand. Okay, I see you remain. And so I know that who I will ask questions later. Pressure. So, um, so again, the topic is all about knowing our body, knowing about location, the shape, the function of all of the organs in the body. And I will try my best to give you at least some helpful information about our body. So in order for us to communicate with our body better. And that is our primary goals of this evening's topic. Okay. And for that, I would like to share, do a share screen. So before we start, is there anyone? So do you can see my presentation? Okay. Okay, good. Let me check with technical things. Okay. So the body. To repeat what Brother Gimo shared last month, that our body is a spiritual temple. Looking deeply into our body, we know that our body and mind are one. Whatever happens to the body, our mind will be affected. Moreover, from both perspective of science and spirituality, our body is a continuation of our ancestors. Thus, we need to take care of our body and mind just as we take care of our ancestors. And that is one of the way that we show respect to our ancestors, and that make our body is a spiritual temple. I think that you all know the practice of total relaxation. And this is one of the focus of our sharing this evening, because the reason that we want to know about all the parts of the body is to help us practice relax better and help us to know which part of the body or which organs in the body need to be recognized and need to be taken care of. And in terms of total relaxation, it is a mindfulness practice that involves being aware of the body and releasing physical tensions. So this is where learning human anatomy is very necessary, as it helps us to practice total relaxation effectively by visualizing and being able to feel. Just like what we've been practicing the guided sitting meditation before, we can feel the location, the shape, and the functions of these organs in the body. Interestingly, total relaxation is widely practiced outside of Plum Village traditions, and this is usually known as the name body scan meditations. We call BSM. So there are some benefits that people experience when they practice this, and I believe that we all experience those benefits, one of which is lower blood pressure. So this is more about during the practice of total relaxations, the sympathetic of nervous system is switched to another nervous system called parasympathetic. So which is the system of rest and digest that allows our body to be in the resting mode and lowers our blood pressure. And of course, when the parasympathetic nervous system is switched on, we experience less pain. That is because our body releases some certain chemical and hormones to activate the pain descending pathway, which relax the muscle. So that is one of the benefit when we are in the relaxing modes. So when we lying down in a lying down position, or when we sit down, or when we just practice the guided sitting meditation before coming back to our body and recognize all of the tensions of our body and releasing them, we will experience the comfort and a relief in the part of our body. And of course, the next one is better sleep. And I think we all experiencing that when we practice total relaxation, do we? And remember, the total relaxation is not meant for sleeping, but because it's easy for us to fall asleep when we practice total relaxation, is because the parasympathetic nervous system is turned on, and that helps us with a lot of comfort and calming down, settle down, releasing all the stress all the tensions in our body. So that's why we feel so comfortable and calm, and that's why we sleep better. And because of that, consequently, we reduce the anxiety and stress. And we know that anxiety and stress, they're triggered by sympathetic nervous system, which is the fight and flight response. So when it is turned off during the practice of total relaxation, stress and anxiety will disappear. And following that, we will improve emotional regulation. And of course, we increase self-awareness because we constantly coming back to take care of our body, to listen to our body. So today's sessions, what do we focus on this evening? Because of the time limit, so what we will focusing on, and let's consider this sharing is another guided total relaxation, which I will take you through the introduction of some essential organs in the body, and starting with the head and the neck, then the upper body, then we go deeper to the heart and the lungs, then the digestive systems, the kidneys, and last but not least, the spine. Okay, now let's go to the top. Are you ready? Remember this one is not don't feel stressed, and you don't have to remember everything here. Just enjoy the slideshow. So in the head and the neck, as you can see in the pictures, you will be surprised how complex the network of the muscle, the vessels, and the nerves in our face and neck. So there is one thing about when we're learning human anatomy, the structures and the location of the muscle will indicate its name and functions. So in fact, this anatomy is very straightforward because when we're able to locate a certain muscle, we will know or we can guess about the function and the name of the muscle. For example, when we look at our face, we talk a lot about facial muscles. When we smile, we relax all the facial muscles on our face, and we have about 20 flat skeletal muscles in our face. We call cranial facial muscles. So the name suggests that cranial facial is mean that the muscles originate from the skull, the scalp, the bone of our skull, then it's connect to the inner layer of the skin of our face. So that's why it's called cranial facial muscles. And we have about 20 of them. They they do a lot of complex movements, so that's why we have a lot of muscles, and they will help us to generate a lot of expressions in our face. And just take an example. Let's look at this one. Uh, the jawline muscle here. You see where I'm pointing at? Do you see where I'm pointing? The big one that connect to the jawline and to the cheekbone here. So we call this muscle here is masseter. Okay, as far as I remember, because I have learned this very long time ago, and that was my past life. So I try to remember everything that I said here. So if you try to open your mouth, and you will see there is a bulging muscle that bulk out. Don't you feel? Don't you feel the muscle bulging out? So that muscle here is this flat muscle here. We call masseters. And when we look at this muscle, it's connected to the jawline and the cheekbone. We immediately able to guess or to have some idea about the function of this muscle is to help us open our jaw, so open our mouth. So like this. It's very simple. So when you look at the muscles, it tells you the function already. But sometimes because there are too many muscles on our face, sometimes we don't know which one is which. We don't know how exactly what it does or what is been there and why it's there and when it gets tensioned. And this is the muscle where we get a lot of tensions. Imagine when you go to the dentist and the dentist asks you to open your mouth widely like that for several minutes or hours. You feel a lot of tension and pain on this side. But it's not just that. When we have some negative feeling like sadness, anxiety, and stress, we tend to clean our teeth. We tend to clean our teeth like this, which causes a lot of activation on these muscles. And over time, this muscle is really tense. So that will give, consequently, is will come up with several problems. So if you experience some like jaw pain or this TMJ pain is also part of this muscle get a lot of tension on here. And most of the time, we're not aware of the presence of this muscle. So that's why we could not recognize when it's in pain. Additionally, we have the neck. So the neck, you can see there are about 30 muscles to support and stabilize the head movement, neck, and the upper part of the spine. And you can see the outermost muscle, which is the bigger one here. Usually, we have two layers of muscle in each part of our body. We call the outermost muscle and the innermost muscle. So the main function of the outer one, usually we generate movement. So every time when you nod your head, when you turn your neck like this, all of the muscle from that superficially, we do that. And the inner muscle, which is really deep, if you can see in the pictures, you see lots of tiny, small muscle that like fencing and wrapping your neck, your spine in the head. They are more stabilizing your neck, stabilizing the head. So it's work the same with other part of the body as well. The outer layers of the muscle will do the movement. the inner layer of the muscle will help to stabilize the spine. However, when we become stressed, when we become anxious, the superficial muscle will get tensed and rigid and take over the job of the inner one. So instead of this muscle just only do the movements, now it's stiff and it's hold your neck, it's hold your head, so you cannot move anything. So whenever you feel really afraid, sometimes you feel so anxious, you don't know what to do, you have some experience of like freezing. That is when all of the superficial muscle get tense up and stop you from doing a certain thing. And over time, if we experience a long time of stress and anxiety, then your face muscle and neck muscle will remain contracted, and consequently, we give you physical tension, headache, and discomfort around the head and the neck. And that is very important for us when we practice total relaxation. We should bring our awareness, just like what we did in the guided sitting meditations. We bring our awareness to those muscles, especially the muscle in the head and the neck, so that we know immediately which one get tense, so we're able to release them. And that is why the half an hour of guided sitting meditation by Sister Remain so nourishing, and I always refer to that. And all what I'm sharing here is just to support that practice of guided sitting meditation. So thank you, Remain. You help a lot in this session today. Okay, next one. Okay, next we will scan down to the upper body, especially the upper back muscle that I want to focusing to. Again, you can see there are many muscles at the back, and they also serve the same principle as in the head and the neck. The outer muscle will do the movement, and the inner will stabilize. And you can see most of the muscle at the back are very big and wide. And you might already know why they are so, because a part of from supporting and stabilizing the spine and keeping the body erect, they also perform a wide range of movements. Because your body chunk, the whole chunk of your body is really big, and in order to deliver a certain movement like twisting or tilting to both sides, bending forward and standing require a lot of muscle to be involved in order to be able to bring up the whole chunk of the body like this. So that is why all of the muscle at the back tend to be really big and wide. But one of the most famous muscle at the upper back that does a lot of work at the back that I would like to introduce, which is called the trapezius muscle. And you can see, is it a very famous piece of muscle? It's famous because it does a lot of things, and it's really, really beautiful muscle at the back. I remember when I learned anatomy in my university, every time when we got an exam about anatomy, we always wish that the topic is all about trapezius, so that because we have a lot of things to say. Why is it so? Because it has a lot of function to our body. So first of all, can you see the triangle here? The triangle muscle at the back? And you can see that this muscle here connect all the way to the the base of your skull at the back also. It's fanning up and it's divided into three parts: the upper section, the middle section, and the lower section. They are one big muscle, but they do different functions to each part of it. For example, the upper section, which is very easy to see and to feel as well, is help you to move your neck backward. So if you're able to extend your neck backward, it's because of the trapezius. If you're able to rotate your neck to look at the back, is it because of the trapezius? And if you're able to shut your shoulder, like when you shut your shoulder, and then you say that, oh, I have no idea what brother TK, brother Thinh have talking about. You shut your shoulder like this. It's because of the trapezius muscle, and you can able to feel it. So you just use your hand, and then you just touch your shoulder. The first thing that you touched is the trapezius, that muscle here. And believe it or not, this muscle is the muscle that usually when you go to see a doctor, and when you, especially when you go for acupunctures to see the Chinese doctor, and you say, oh, I had a lot of shoulder pain, I have a lot of back pain, they will treat on this one first, because this one is in fact a very sensitive muscles. Why is it so? Because it's been active days and nights. That's why it's become very sensitive. So especially when you have some negative emotions like stress, anxiety, worry, fear, this muscle will tense up. That's why it's a very important when we do sitting meditation or guided sitting meditation, we always instruct our friend to say, relax your shoulders. What we mean is relax your trapezius, relax this one here, because this one tend to stand to really tense up very easily to get tense up like this. That is the upper part. What about the middle part? The middle part, as you can see here, is wrapped around your shoulder blade. So what is the function of it? When it's wrapped around like this, it means it protect and support and stabilize your shoulder blade. Especially when you do a lot of movement like bending forward to wrap something, especially when you're holding someone, like when you're hugging someone, when you practice hugging meditation, your shoulder blade will go around, will wrap around. And in order to stop your shoulder blade be dislocated from your body, this trapezius, the middle section, hold it to stay intact with the body. So that is why it's very important of the middle part of the trapezius to keep your shoulder blade in place. And again, the lower sections of the trapezius, as you can see, is attached to your spine and connected to everything else in the body, like the shoulders, the neck. So we already know the function of the lower part, which is help us to stay erect, keep the posture straight, and stabilize the spine. And why the trapezius is so important, so as I just shared, because first, it's easily to get sensitive with a lot of things, especially to the negative emotion, but it's also become very sensitive to a certain posture, especially when we are now living in the modern society where we are exposed to a lot of computer work, office environments. This is how our trapezius get a lot of problem recently in the modern society, which is a poor sitting posture. We call slump position. You can see on the pictures here on the screen where someone sitting and tapping on the with the computer like this, and with the shoulder is like that. So if you can imagine, so sometimes you just try yourself, like if you do a slump like this, where you over bending your back, and then your neck is kind of like protrudes forward, you will feel that the muscle have to like work really hard to keep your shoulder placed, to keep your neck, to keep your spine from being too over bending. And if you do that for several hours, of course, the muscle is really in pain. And that is why it's very important. During the total relaxation, we should pay a special attention to this muscle because it's very to get tense, especially the upper part. Now, are you still with me? Okay. Okay, good. There's a lot of things, but again, don't need to be stressed. Okay, relax your shoulders, relax your trapezius, and we move on. Okay, now let's go to the front of the upper body. when we learn human anatomy, we will discover how intelligent of our body is. Its head is on awareness. And throughout the human evolutions, our bodies have learned to adapt and respond to a current situation. And hence, our body knows how to protect itself for making sure all of the vital organs are safe from potential harm. So in the upper chest, we have the bony frames. As you can see in the corner pictures on the screen, we have what we call a rib cage. You may have a guess that why it is there and what is the main function of the rib cage. Do you know the function of the rib cage remain? Do you know?
To protect the lungs and also the organs that is around the area.
I can hear you.
Can you hear me now? No.
Can't hear. Speaker. From us. Oh, maybe from our side because our speakers here is turning off. Okay, I might understand that you say that the rib cage is there to protect the heart and the
Lungs,
lung, isn't it?
the heart, the lungs, and also some of the organs that is underneath the rib cage, like the spleen and all that. The small little organs, kidneys.
Good, good. So the rib cage is there to protect the vital organs. It's also one of the stations for all the muscle to get attached to it. But the main function of the rib cage is to protect the vital organs. And the vital organs here is the lungs and the heart. Why they are vital to our body? Is it because you know that the heart is the powerhouse organ of the body? And as you know, in the guided sitting meditation, we learned that the heart pumps, continue to pump days and nights non-stop in order to keep ourselves alive, in order to keep all the organs alive. And we need to know where our heart is. General idea, we learned that our heart is somewhere on the left side of our chest. But actually, the heart is in the center of the chest, but tilted to the left. And the side of the heart is more to do with the human feet, the adult feet. So if you hold your hand, so can you show me your heart? Okay, so this is the side of your heart according to based from your feet side. This is your heart. Relatively, this is your heart. And this is your heart, you place it in the front, in the center of your chest, in the center of your chest. Not the right side. No, the right side is not where your heart is. The right side is the lung. And not all the way to the left, because I saw a lot of I remember one of the teenagers in the retreat, they saw that be aware of my heart, and then he hold all the way here. No, it's not. It's in the center, okay? And then it tilted to the left, so it's tilted. Okay, so you just a little tilt on your left. This is where exactly your heart is. Okay, so your heart is that side. That's small compared to the whole other organs in the body, but there's a lot of things, days and night, and it's pumping approximately 115,000 times per day, non-stop. And the main functions, as you know, is pump the blood with oxygen to nourish the whole body. And then it receive the carbon dioxide, the waste of the blood back to the chamber of the heart. Another fun fact about the heart is even the heart continue to beating even when it's disconnected from the body, because the heart has its own nervous system. So the heart still continue to pump. That's why it get a lot of energy from it continue to pump even though it's get disconnected from the body. And wrapped around the heart is the lung. So the lung we called two big balloons in the body. The reason why it's called balloon because it's act like a balloon. So you can say it's a really it's hollow and it can inflate and deflate when you breathe in and breathe out. So it facilitates the oxygens to the body. And you can see structurally, you can see this the right side and this is the left side, if I'm not wrong. To say depend on the pictures. Because the left side we have the cardiac notch. It's you know why it's have that shape because this is the shape of the heart. Can you see? So that means this is the right lung and this is the left lung. And the right lung, of course, is relatively bigger than the left because the left being occupied at some of this section here for the heart. But if we look deeply into the lung, you can see that there are a lot of tubes. And within that a lot of tubes, microscopically, you can see there's a lot of bubble here and a lot of small vessel here. This is where the gas exchange happening deep into the lung. So imagine when you breathe in and breathe out, the air travel from the nose going down. We call this one is a trachea, and then it's go to either two sides of the lungs, and it's continue to go all the way till the end of the tube, and this is where they meet all of the vessels, the veins here, where it can deliver the oxygens to the blood, and the blood return the carbon dioxide back to the lung. So the lung, when we breathe out the carbon dioxide. And along the track, there's a lot of hair, along the tube here. And can you guess why the hair is there? We call the hair is the cilia, the very tiny hair that in the respiratory tract is play a role of deliver all of the dust, all of the flame, all of the bacteria out of the respiratory system. So you can see that our body is really mindful. It has its own wisdom. It has its own awareness. It has its own protective mechanism in order to protect itself from potential harm. And you can see that how vital it is to keep our heart and our lungs healthy. The more we understand why they are there and how they work to keep our body survives, the more we feel grateful to them. So that is why during the guided sitting meditation, every time when we breathe in, or when we even practice the total relaxation, when we scan down to our heart, we remember the function of the heart. We remember where it is in our chest. We remember how hard it is to provide or to nourishing our body. We breathe in, we be mindful of that. We breathe out, we say thank you. We say thanks to the heart. We say thanks to the lungs. That is why it is so nourishing, so effective in the practice if we're able to practice being aware of the heart and the lung by breathing in, breathing out, we say thanks to them. Next, but still on the topic of the upper body, there is another important muscle that I must share with you is the diaphragm. So the diaphragm is a dome-shaped muscle that separates the chest and the abdominal cavity. So if you and this muscle is really hard to feel, and we can only feel this muscle by belly breathing. So that's why it has a very important role in breathing, especially the belly breathing. Why is it so? Because the diaphragm is when it's contracted, is we going down. So it will create what we call a vacuum. So that pull the lung able to expand more room to expand down. So when we do a deep breathe in, so everyone can have a try. So breathing deeply, we can feel that the lung is going downward. And at the same time, we can feel our belly is rising. So it is because when we do a deep breathing, the diaphragm contract, it creates a vacuum that pull air into the lung deeper and more downward direction. So as the diaphragm contract, it creates a pressure in the abdominal cavity, which make the belly rise. So that is why when we practice belly breathing, we not actively try to move our belly forward, because that is not the main thing that we try to do. The reason the belly is rising is because the constructions of the diaphragm. So instead of trying to make our belly rising, we're just trying to make a deep breath in. Okay, what I say trying to make is we need to allow the process of the in-breath go naturally. And eventually, when we're able to relax our body, then the diaphragm will start to activate it. So that's why we have a deep in-breath. We expand the lung downward, and naturally, the belly will rising. And when the diaphragm relaxes and return to its own original shape, it pushes the air out. So that's why we experience the belly go in. So when we talking about the belly breathing, then try not to think that we have to actively make our belly rise and fold. It's not the main thing. We just do a belly breathing by just be conscious about the going downward of the lung rather than try to force our belly to move out, because a lot of people, when they try to do making the belly to go forward rather than trying to practice to deep breathing, their breathing is still shallow at the stage because they are forcing themselves to do a belly breathing. But in fact, a belly breathing is a relaxing process that allows the diaphragm to activate it. So by learning this one, we know that practice belly breathing require relaxation rather than we actively are forcing our belly to rise and fall. And this is a fundamental mechanism when we practice belly breathing. Now, are you still with me? Yes? I know this anatomy is a very dry and quite often help you to activate the parasympathetic system, where you might feel relaxed and sleepy. It's okay, which is I'm doing a right job, because this sharing is all about making you feeling relaxed and feeling sleepy rather than become very stressed with a lot of information. Don't worry, you don't need to remember all of it. Just relax yourself, relax your shoulder, relax and allow the belly breathing, relax so that your diaphragm able to work. Okay, next, we will go to the digestive system. This is where the communication in the body is so vivid, and this is very living in there, because those organs, we have five organs in the digestive system that does a lot of communication, and they're living joyfully together. So first is the liver. As you can see, the liver is located just under the rib cage, so more to the right side and underneath the diaphragm. So when we do a deep breathing, the thing that you feel pressure been going down and then you feel something touching it, that is the liver. So we can actually can feel it, even though it's not directly, but we can feel it from the touching of the diaphragm with the liver, because the liver just right underneath the diaphragm. So this is the shape of the liver. And because it have that shape, is because this is the shape of the diaphragm on top as well. So if we do a deep breathing, a belly breathing exercise, we actually can feel the presence of the liver underneath the diaphragm. And what it does, the liver, so it helps the body digest the food, remove waste and toxic substances, and regulate blood sugar level. I think this one is quite common knowledge that we all know. I just like am reinforcing it. Next one, which is the gallbladder. If you're going down from the liver here and then you go down, you see there is the green one. I don't think this is will be a real color in the body of the of the gallbladder, but it's just here for the sake of the pictures. So it looks like a pear. It looks like a pear, and it's on the right side as well, just underneath the liver. And it's released the bile, which is one of the substances that help to that help with the digestion for the intestine, and also it's work to the liver. It's also work with the stomach as well. So the gallbladder is very important, and is also one of the great assistant and the communicator with the liver, with the stomach, and with the intestines as well. Next one is a stomach. So you can see the stomach is on this side here. It's a very pink, and of course it's not gonna be pink in real life inside our stomach. It is a large, hollow, and really muscular organs. Why is it so muscular? Because it has to pump the food, and it also have to store the food. That's why it is hollow and it is muscular. And it can hold 2 to 3 liters of food. So imagine that we eat the dinner and then we go to the restaurants, we have a really big meal, and then we feel that the stomach is really expanding it can expand to store a lot of food in our body. Interestingly, the stomach can digest and deliver the food to intestine within 2 to 4 hours. This is very important, and this heavily depends on the type of the food. What does it mean? It means that when we have a breakfast, we have a big breakfast, depend on the food that we have. Imagine that we have instant noodles, and then or we have hot pot as the dinner, or we have one day when you go to Thai Nung village and then brother Thinh Khong, brother TK cook you spaghetti, a really big one, and it's so delicious that you had 2 dishes of spaghetti and it stay there in the stomach for the next 2 to 4 hours or more. Why is it staying there for that long? Because the intestine, the stomach, sorry, the stomach can only breaking down and absorb some certain proteins, some certain carbohydrates, but not a lot in the fat. So all the rest of the food is will deliver to the intestine to do the further digestions. That is why it is very important to chew the food at the mouth for 30 times. That is what is meant by the practice that our teachers taught us, that when we eat our food, we need to chew the food, and then we have to allow the food digested before it goes to the stomach. So we can help the stomach a lot of time. We can save a lot of time and energies for the stomach to work. So if we eat the food and then we swallow it right away, That means that our stomach have to work harder to break the food, and it will stay there for longer, and then before it's transferred to the intestine. Having said that, we have some other organs that also help with the digestions in order for the stomach to work really fast and efficiently, which is the pancreas. So the pancreas is another one. As you can see, behind the stomach is the yellow one, look like a beehive. It's behind one. Is a pancreas one of the famous most organs, and is also really susceptible to disease as well, a lots of disease that relate to pancreas. It's a large gland in the back of the abdomen that support digestion and regulate blood sugar by releasing hormones. It also supports vital organs like heart, liver, and kidneys, so it does a lot of job. And it stays behind the stomach. So next one is the small intestine and the large intestine. You see here, the one in the middle is about 3 to 5 meters of small intestine and connect with the last intestine, which is wrapped around here. And is the last one, the last intestine is about 1 to 1.5 meters. And they do the main job of digestion, absorbing nutrition and water and break down food. So you don't need to remember all of this, but the key points here, the organs in our digestive system is a remarkable communicative environment. So as you can see, they are so related to each other. The moment that we eat our food to enter the stomach, the liver, the stomach, the gallbladder, the pancreas, the intestine, they start to work, they start to communicating, they start to transfer hormones, they communicate with each other by releasing some certain hormone, telling them, signaling each other to get help, to get support. So we have a feedback mechanism, we have a weight management, we have a digestion management, we have the absorptions, progressing food management as well. So imagine the digestive system is the whole factories where we have a lot of workers and departments, and they have a really good communicating with each other. But most of the time, we don't communicate with them. And that is why sometimes we see the food so delicious, but the stomach tell you no, no, and we ignore what they say. And we still keep receiving, regardless. They work really hard to break down all of the food we ate. Up to the point when they are so tired and they are so fatigued, they could not communicate with each other effectively anymore. That is when illness, that is when disease happen. So it's very important for us to communicate with them so we can have a better understanding, and then we will adjust our behavior and habits so that we can help them to work better. Nearly there, everyone. Still stay with me? Okay. Next one, another essential organ that we should pay attention is the kidneys. As you can see, the kidneys is at the back of your body. So every time when you have the back pain, especially the middle part of your back, and it really pains days and night, constantly or even exaggerated for no reasons, you know that is not something to do with the muscle and you still experience back pain, that is one of the messages that your kidney tell you that there is something wrong with the kidney. So that is how we should going back and listen to our body in order to recognize immediately the signal, the emergency signal from our organs. And most of the people have two kidneys. We sit at the back of the abdominal cavities, just below the rib cage. The left is slightly higher than the right. And the main functions of the kidney, as you can see, the kidney is like we call a bean shape. What kind of bean is it? I think it's a wide bean shape. And you see it's really vascular. So whenever the blood come from the liver, come from the heart, go in here, the main job of the kidney we call a backup factory. So whatever is we pick up whatever left over the waste, the toxic, mainly proteins or mainly the waste in the fluid in the blood that doesn't need in the body, we will take it out. And this will go to the as a urine. And then it's also recognized, oh, this vitamin, oh, this one we need to the body, it will send it back to the blood. And another reason the kidneys here is so important is because it not only does the job as a filter, but can also communicate to all other parts of the body. And this can do a lot of things to the body. For example, when we have low blood pressure, the kidney can also involve telling the heart that we need to pump more, we need to release more hormone in order to produce more red blood cells so that we can rebalance the blood pressure. When you have low sugar, the kidney can also send a message to the liver, tell the liver to regulate the hormone so that it's balancing the sugar level. It's also tell the brain that we need to go to the toilet, for example, like that. So the kidney have a lot of there's a lot of communication to other parts, other organs of the body. That is why when we practice, especially when we practice total relaxations, we need to pay a lot of attention to the back as well. Because in the back, not only the muscle doing, but also the condition of the back also tell you what is happening inside, which is the closest one is the kidney. Okay, last but not least is the spine. Very interesting. We have about 33 bones we call vertebrae that separate from each other with the intervertebral disc. We called it has the four main functions. So first of all, you can see the reason is there, and the reason is in this shape is for protection. Inside the vertebrae here, you can see there's a spinal cord that go inside of this all the way to the brain. So it's played a job as protection. Second is support. It's go because it have that S shape here, is act as the weight bearing, shock absorptions. So to keep your posture straight and forming a body structure, which is the third function of the spine. Fourth, and of course, is there's a few movements with the thanks to the spine, we can twist, we can turn, we can tilt, and the joint of the spine because it's not one bond, but it's 33 bonds because it helps us to be more flexible, more dynamic in the movement. Here's is the thing. Every time when we do sitting meditation, we tend to say, keep your body straight, keep your straight but not tense. It doesn't mean that we try to make our spine straight in a straight line, but we try to make the spine back to the original shape. So when we get instructed that keep your body straight, don't do really tense. Okay, because it's not a natural posture of the spine. You need to allow your spine in that natural curve. And how do we know whether our spine is in the natural curve? It's very simple. When we sit on the chair like this, or even when we sit on the cushion, that's why we sit on the cushion 1/3 of the cushion, allow our knee touch the floor. We allow that tailbone here. So you see that tailbone, the green one. And remember, it's not green in real life, and it's not purple in real life. when we sit at the cushion, 1/3 of the cushion, we allow the tailbone to tilt forward like this. And when it tilt forward, eventually, consequently, the lower back, which is we call a lumbar section here, we go in that curve. And consequently, our chest cavity, the thoracic spine, will in that shape. And when we work at the computer, our neck tends to be go forward like this. And when our neck is go forward, it also affect our thoracic spine to go forward, to bend forward as well. So when we go in that position for very long, our neck gets stiff, our thoracic gets stiff, and we try to force ourselves to go back up. But actually, because it's really stiff, the moment that we try to force ourselves to go straight, we're just moving the whole thing like this. So which is not really natural. But instead, you just move the neck. So for example, when your neck is like this, that's why consequently, can you see me? So when your neck is like this, naturally your thoracic spine will go forward like this. So the very easy to fit is to move your chins back. So move your neck back. Then your chest spine will go back to its original positions. So don't try to move everything like this because you don't move anything. You just like try to bring the whole thing in the opposite directions, but rather you just move your neck spine back. So a very small movement like do like this. Then you can fix your chest. Okay? Right. This is the last slide. Congratulations. In summary, why do we need to know all this? Why and how does this relate to our practice of mindfulness? Why do we have to learn the anatomy for? Because in the Buddha times, and as you can see, the discourse of the four establishment of mindfulness, it's also mentioned that in the Buddha time, the monk also practiced mindfulness of the body's organs, and they consider them as the impurities. And because they practice contemplation in that way, so that they're able to transform the attachment or sexual desire to the body. So in the text, you can see that when we practice a body contained inside the skin and full of all the impurities which belong to the body. And here is the hair of the head, the hairs on the body, the nail, teeth, skin, flesh, sinews, bone marrow, kidneys, heart, so on and so on. But in the modern practice, on the other hand, especially in particular, the total relaxation, we practice being aware of the presence of those organs, but we recognize in terms of we recognize the body's tension and stress in order to release them, and we can also recognize the function of its organs so that we can cultivate a sense of gratitude toward them. So that is the practice of total relaxation in our modern times. Last but not least, I would like to conclude this sharing with a message that mindfulness is being aware of the objects of mindfulness at its ease. So while practicing mindfulness, particularly when we practice total relaxation or guided sitting meditation, or even guided walking meditation, we are not imagining. We are not imagining the location, the shape, or the function of the body organs, but instead, we contemplate them in their exact location, the nature, and the function within our body. So thanks to the advance of science, so with clear understanding of the body's anatomy, contemplating it can effectively generate awareness and love for the part that suffer from tension and release stress. But furthermore, if we practice this in the deeper level, by applying the body's anatomy to the deeper level of our practice, we can come to realize the natures of interdependent co-arising of the body and transcend the attachment of the body as a separate self. So with the practice of knowing our body, communicate with our body by knowing where it is, knowing the location, the shape, and the function of its organs in our body, knowing how important is it to communicate with our body. We already nourishing our body, and we can also cultivate and generate the energies of mindfulness at the same time. So thank you for listening. That's it for my sharing. Thank you.
Thank you, brother TK, for the talk. I'm also just reading some of the message in the chat as well. So I think some actually says that this is very interesting. It's so insightful. I think really to know the different parts of our body, where they are, how they maybe look like. I think it's helpful for us when we actually practice our guided sit or even our total relaxation and really sending our love to them to be able to know how they actually communicate with each another. It's really a miracle, not just having a body, but I think a miracle as to how this body actually works on its own. And besides sending our gratitude, I think is loving our body, um, and really caring for our body, taking care and sending love, or even saying sorry. Sometimes we neglected them. I think that's really helpful, for us to be able to deepen our practice. There was also some questions. Can share the PowerPoint. So far, I think the first segment, I think we did. We'll figure out a way, I think. Yeah, maybe brothers, what are your say? There is also a request for the recordings. So for the tonight's recording, we will actually be uploading it to our Joyful Garden Sangha YouTube channel. So even Brother Kinok's first session is also over there as well. Just give us some time for us to upload the video. Yeah, we will share with the different Sangha when we actually upload the videos. There's a request, someone requested for Brother TK Spaghetti. I'm not sure how that's going to be done, but um, so I think there are some questions. So perhaps here is now transiting to the question and answer segment. So the before we go to the question and answer, so the YouTube channel is Joyful Garden Sangha. Yeah. Later I'll text it in the chat. So I think there's a question is how do we relax tension when we practice? Yeah.
Yes, so dear friends, how do we relax? It's a very good question because for my own practice, the first times, like when I first practice relax, I tried my best to be relaxed. And the more I try to be relaxed, the more stressed and tense I am. So for my own practice, I learned from that. And in order to be relaxed, first of all, we need to not worry too much about to stay relaxed, but rather going back and be aware of what is happening in our body, and just to not to get involved or not to try anything when we have recognized the tension or anything, just to coming back with our body. That is the first step of becoming relaxed. When I practice in either positions, so relax is not just about lying down. Being relaxed can be done in many postures like sitting, walking, um, standing, even when we are able to relax in our daily activity as well, not just a static movement like standing or sitting. The reason is that is the key is to be aware of the presence of our body and how our bodies react to the environment. It's really big term, but I make it simple. If you want to be relaxed, first, don't try to be relaxed, and rather just going back and recognize what is going on in our body. For example, when we're sitting right now, when we are sitting right now, first of all, do we know that are we sitting or are we standing? We have to make that one first. So first of all, we know that we are sitting. Then how we are sitting? Are we sitting tilted to one side? Or are we sitting a little bit forward? Or are we sitting a little bit backward? Or are we sitting with our neck in that position or in these positions? And if we already know our positions in our sitting, then eventually we can start becoming aware of our body. And then we can start with a breathing exercise. We can start with breathing in, knowing that we are breathing in, breathing out, knowing that we are breathing out. And being relaxed is not just everything that we're trying to do just then, what I've been said, is not about trying to relax. It's all about knowing what we are, where we are in the present moment. And if we're able to doing that for a longer time, the relaxing will be possible. So in order for the relax to be possible, we have to totally be present and recognize our present, our body, the presence of our body in the here and the now. And the more we're able to recognize it, then the more able we give more a chance and the opportunities for our body to be relaxed. So that is come from my own personal practice. And maybe Brother King can have a little more share about how to be relaxed. Do you have anything to share?
I think what Brother Thinh Khong shares is wonderful. Being aware, it's a mere recognition. Just recognize what it is. Yeah.
So thank you.
So there is also a question. When our leg and foot go numb, does it mean wrong or improper sitting position?
What's the question? The question is when our leg and foot go numb, does it mean wrong or improper sitting posture? When I do sitting meditation, my leg got numb a lot, and this is very natural. Maybe some of us might experience more numb than the other. No, this one in anatomically is depend on the size of and the structures and the innovations of the leg as well. So everyone we experience the numbness differently. So when we're talking about, let's say, sitting meditation, when we sit in the 1/3 of the cushion, one way or another, the back of our thigh will be compressed with the cushion. And then we sit there for maybe 30 minutes, 20 minutes, or even more, 45 minutes. Then we know that some of the vessels, some of the nerve will be blocked at that time. But thanks to the collateral veins and blood, the blood will still flowing. But that part of the session we get numb somehow, but some of us might experience less, and some of us maybe experience more. And what happens when we experience numb? It doesn't mean that we sit in the improper position. It's just a natural process, a natural response, and a natural mechanism of the body. When we sit, even we sit on the chair like this, not sit on the cushion, or even when we stand up, we also experience numbness. This is all about the circulation of of our body, and also the innovation differences in our body. So when we look at our body anatomy, we have some slightly difference in terms of nerve innovation, in terms of circulation innovation in our body. So to be when we having a numb experience, when we do sitting or standing or in any posture during the practice, it doesn't mean that we are sitting in the wrong posture. Of course, sitting improperly, maybe sitting on one side tilted to the other, may also have numbness, but the key is, again, knowing how we are, knowing where we are, how our posture in the present moment. So when you feel numbed in your body, in your leg, first of all, aware of that. First of all, aware of the numbness of your leg, of your foot, and then you can have a body check whether or not you are in the right positions. You can open your eyes. You don't need to force to close your eye the whole time when you do practice sitting meditation. You can open your eye and see if you have any wrong postures or something. You can adjust on that, and feel free to change your posture when you're feeling numb. You don't have to force yourself to sit in that position uncomfortably for 30 minutes or 45 minutes. That is hard labor. So whenever you feel uncomfortable, when you feel numb, and that numb is bothering and you're totally aware of it, you can mindfully change the posture. So in the way that you can feel comfortable to the body, because the key is to make our body relax, and not rather making your body becomes a hard labor factories that forcing the body have to be there, even though it's numb, but forcing it to sit there for 30 minutes, then it's a very pitiful. So again, when our leg feeling numb, when our foot feeling numb, it doesn't mean that we are sitting in the wrong posture. It's a natural process. And being aware of the numbness is also an opportunity for us to cultivate mindfulness. And we can also, with the more we are aware of the numbness, it will give you an understanding and insight that leads to an action that we decided to change the posture mindfully in order to make our body relax again. Hope I can answer that questions. Thank you.
Thank you, brother. There is one, perhaps this will be our last question. When we meditate, there is a lot of things to be aware of. We can notice our breath or many specific aspects of our body. When we are aware of our body, how do we know what to notice, when and how to notice it?
That is another good question. So maybe Brother Gilmore, do you have any idea?
So, dear friends, suppose if you are in a very dark room, completely dark room, you don't see anything, and now you have a flashlight. How much you can see? A little area that is lit up, right? You can see one chair, you can see a cushion, you can see a clock. This, and you have to move your flashlight to many places to try to see everything in the room, but you can never have a complete picture. If that flashlight is mindfulness, what happened when is that flashlight become the ceiling light? You just look and you see everything in the room, right? You don't have to move the ceiling light in order to see everything in the room. So the same thing with mindfulness. When you just the beginner, when you just practice being mindful, your energy of mindfulness is so small, like a flashlight, but it's good. At least it's light up. So when you start to see, you see, wow, the world is so different and so many things to see. How can I see everything? But don't we worry about that. You just need to continue the guidance, continue with the basic practice. So your energy of mindfulness grow up and grow up. One day it become the ceiling light, and one day you become the Buddha, like the sun in the sky. Nothing in this world you cannot see. Even in the moment, everything is clear. So if you look in that direction, will not be a question anymore.
Thank you. There's one more
Is the
comment.
time?
Yeah, it's time. So there's just one comment from my experience. The numbness eventually goes away even without having to change posture. So I often just notice it and wait for it to go away. Bracket, not sure if this is the proper way though. So I think it's a comment for us just to sit, contemplate a little bit, and perhaps to use our next practice to see when there is any numbness, whether be it sitting, standing, or walking as well.
Okay.
So I think with that,
Yes,
maybe.
about the numbness, for now, please consider it's just the body problem. Okay. But when we go more advanced in meditation, we know that the numbness is not just about the body, it's also about the mind. And your capacity of sitting for long or short is no longer based on the body anymore. But just for now, for a wake up activity like this, we don't want to go too deep into that. But if you keep up to follow the practice and the exercises, one day we can talk about that. Okay. Thank you.
Oh, thank you. May we all offer flowers to our brother Kinok and brother Ting Kong. Thank you. So we'll stop the recording for now.